Well, good morning. I'm Pamela Jacobson. I'm a professor in the Department of Experimental and Clinical Pharmacology in the College of Pharmacy and director of the Institute of Personalized Medicine in the College of Pharmacy. We're excited to welcome you all here today at the University of Minnesota for our inaugural Precision Medicine and Pharmacogenomics Conference entitled Pharmacogenomics Research to Implementation. The response to the conference has been overwhelming. We had originally planned for an attendance between 100 and 120 individuals and had slated this to be held in our state-of-the-art cancer and cardiovascular research building just on the other side of the stadium. But by April, we had outgrown that space and we moved it here to this McNamara Alumni Center. So thank you very much for your interest in pharmacogenomics, and we'll get on with the day. So before I go any further, I have to take a moment to thank some of our sponsors. We are very grateful to these companies and our Masonic Cancer Center for helping us build a forum for insightful discussions about pharmacogenomics. Our sponsors have booths here today, so be sure to stop by and visit them. There's some booths out front, there's booths here in the back and some over to the side, so please stop by and see some of our sponsors. We also have posters here today you can see the poster boards in the back by some of the university faculty who are active in pharmacogenomics, and they have brought some of their work here today to share with you. There's also a table hosted by the Minnesota Supercomputing Institute. You can learn about some of the services of the MSI group, data management and informatics. They're very happy to collaborate. We also have a poster given by our Biomedical Genomics Corps, BMGC. This is a center that contains the university's state-of-the-art genomic instrumentation, and they are also here to talk to you about any collaborations that you may have if you need a genomic instrumentation. I would also like to acknowledge our wonderful conference organizing committee who were critical to organizing the event today. We wouldn't be here advancing the conversation about pharmacogenomics without them. Robert Straka, who's a professor in the Department of Experimental and Clinical Pharmacology, who does work in cardiovascular and special populations. Jeff Bishop, who's an associate professor in experimental and clinical pharmacology, who works in the area of psychiatry pharmacogenomics. Bill Oding, who's a geneticist with interest in pharmacogenomics of low therapeutic index drugs and albinism. Brian Van Ness is a cancer biologist and geneticist in the Department of Genetics, Cell Biology and Development and works in the area of multiple myeloma. Jacob Brown is in pharmacy practice and pharmaceutical sciences on our Duluth campus and specializes in pharmacogenetics in children. Susan Moreno is a neuroscientist who's interested in drug effects on cognition. And Sam Callisto, although not faculty, he someday will, but he is a graduate, one of our graduate students, and he has worked hard at putting together the details about the genetic testing. So you can thank Sam and others for all the genotyping, the nice little genotyping results for you that some of you have in your packets. I especially want to thank our staff, who are the ones that really organized this conference. So Danielle, Erin, Mary, Maureen, Aline, April, Kate, and Jessica Ward-Dennison. Mary and Kate worked particularly hard at putting this together, and for you who are speakers or registrants that had questions, Mary would have been the one that you were communicating with. So thank you very much to our staff for doing this. And finally, the College of Pharmacy and the Department of Experimental and Clinical Pharmacology have been instrumental in supporting this event. In particular, Dean Marilyn Speedie has been a strong supporter of precision medicine and pharmacogenomic initiatives. We are so pleased to have her here this morning to open our proceedings. Ladies and gentlemen, please welcome the Dean of College of Pharmacy, Dr. Marilyn Speedie.
Thank you. My job is to say welcome. And you are indeed all welcome. We are very excited to see so many people here today, and I think it certainly supports the concept of having a conference like this when so many people signed up so fast, and from all walks of science and pharmacists and professions and lots of different people. we have a triple purpose today. It may be more than three, but the three I was thinking about is, of course, education of all of us, and a look at the future, the present and the future, I guess is the better way to say it. I think for the experts in the room, it's an opportunity to learn what others are doing and to develop further collaborations. And it's also for us a celebration of how far the College of Pharmacy has come with pharmacogenomics over about the last decade. The interest of the College of Pharmacy in pharmacogenomics was kicked off more than a decade ago. It became very apparent that if we were interested in forecasting responses to drugs, which we were, the patient's genetic makeup had to be considered along with many other factors. It was becoming clear that genes could predict metabolism, side effects, and in many cases, some of the disease targets that the drugs were working on. Most of our faculty who worked in human pharmacology recognized the need to add an element, at least, of pharmacogenomics to their research. And so we sponsored a series of faculty development seminars and workshops to bring everyone up to date. We also focused on hiring faculty who were experts in pharmacogenomics. They began to succeed and have succeeded well with funding and research, and formed what we called PUMA, Pharmacogenomics University of Minnesota Alliance. That was the group of people working on pharmacogenomics to advance collaborative work in the area. We have continued to grow in funding over the years and in faculty, and we actually look forward to adding a new faculty member this year, pretty soon, we hope. We have far to go to really realize the goal of being able to apply pharmacogenomics to every patient who would benefit from its use, and to see pharmacists involved in applying our knowledge to practice. That involves much more science and much more interprofessional collaboration than we have achieved so far. But I think we're on our way, and I'm firmly convinced that it is within our reach and of great value to the lives of patients. But pharmacogenomics, the application of genetics to drug therapy, is only one part of the picture. In his 2016 State of the Union address, President Obama identified the development of precision medicine, a new term or a choice of terms, as a top national priority. Whether you call it personalized medicine, individualized medicine, targeted therapies, by whatever name, precision medicine recognizes that we will all benefit by having our therapies better matching each of us as individuals, including our genetic makeup. It includes pharmacogenomics, but it also includes other genetic determinants, epigenetics, cancer cell targeting, and a long list of other determinants. Our group, in the context of the university's Grand Challenge strategic plan, recognized that we could get much further by aligning the challenges of pharmacogenomics with other genetic technologies. The tools and approaches are similar, whether you are looking at an individual for preventative health challenges, for disease targeting, or for drug therapy. And so the Precision Medicine and Health Collaborative was conceived, and faculty across the university were recruited to join together to tackle these issues. There are now more than 75 researchers bringing their interests and expertise to the table. This exciting initiative, even at 75 faculty, is in its infancy, but the number of people who have joined shows broad interest across the university in this grand challenge of our time, and it is indeed a grand challenge for now in medicine. I look forward today to listening to learn more about our progress and the approaches we are applying to address this exciting challenge. I hope at the very minimum it stimulates our imaginations. I know it will, and will also lead to further collaboration among the scientists and the pharmacists and the physicians and so on in the room. So thank you for being part of it, and again, welcome.